Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and here's my roundup of the key issues relating to dentistry for this week. We have a new survey out at the moment which seeks to identify the financial pressures that all practices are facing across the UK, including those with mixed and private income streams. Jason Wong, the new Deputy Chief Dental Officer for England, is leading a group looking at these pressures, in particular on those relying on mixed and private income, with input from all four nations and a range of stakeholders from other dental organisations. It's a nice short survey and it's only open till Monday, so please take 5 minutes to complete it if you're a practice owner. The link is below. Despite months of repeated requests, we're still waiting for confirmation from NHS England on the abatement that's going to be applied to NHS contract values for the period up to the 8th of June. GDPC Chair Dave Cottam wrote this morning to Minister Joe Churchill to express our frustration at these unacceptable delays. We remain hopeful and actually anticipate confirmation about the abatement early next week, as well as clarity around the contractual provisions being applied in the current circumstances following the resumption of face-to-face care from the 8th of June. We were also anticipating a report this week on fallow time, which we know is causing a huge amount of anxiety. Work's been undertaken on behalf of a collaboration of public health agencies across the UK who've created a working group investigating the controversial issue. We'll update you on that when we have more. The Chief Dental Officer for Scotland, Tom Ferris, wrote to dentists this week to clarify arrangements for the third phase in the return of dentistry. That commences on Monday, the 13th of July. In practice, we're like to see very little change with phase 3. Dentists will be able to see patients for routine care, but any treatment requiring aerosol generating procedures will still be referred to urgent care centres. We know that's likely to cause frustration amongst patients, and we've urged the Scottish Government and NHS boards to manage patients' expectations so that they're aware of the kinds of treatment that they can expect in practice from Monday. CDO also outlined additional funding in his letter, an extra 30% on the general dental practice allowance and a 30% increase to the GDPA cap. We welcome this funding. However, we don't believe it's sufficient to restore practice income to pre-COVID levels, and the reality is that many practices will continue to struggle. We're also expecting to see a revised version of the Statement of Dental Remuneration next week, and again, we'll keep you updated once we know more. As you may recall, we recently gave evidence to the Northern Ireland Assembly Health Committee, in which we raised many of the issues facing dentists as a result of the COVID-19 crisis. Well, yesterday, the acting CDO in Northern Ireland, Michael Donaldson, and Paul Montgomery from the Department of Health also appeared for the Health Committee in response to the issues we raised. After a robust session, the Health Committee agreed to take a number of our concerns directly to the Health Minister. These included the lack of supply of higher level PPE and the impact that this is having on practice finances and patient care. Fallow time and the scientific evidence behind the 60 minutes that practices must wait following every AGP. And finally, issues with the financial support scheme, which include unfair treatment of maternity cases. We'll update you when we have more on this, but in the meantime, if you want to watch the Assembly Committee session, the link is below. Since the 1st of July, dentists in Wales have been able to offer more treatment in practice, and the criteria for urgent care referrals has been relaxed. So to support you with this, we've adapted our toolkit for members in Wales. It's to be used alongside the Welsh Government's guidance to help dental teams complete their assessment of clinical oral risk and need, or ACORN forms, for patients both routine and urgent, and you'll find the link for the toolkit for Wales below. Also this week we had confirmation from the Welsh Government that they will be funding all PPE, including FFP3 masks, for practices with NHS contracts in the amber phase. Welsh Government also shared details of reputable suppliers of PPE with private practices. And that's all from me this week. I'll be back with more news next week. Until then, have a safe and healthy weekend.